Thank you for tuning in to Global Elite Academy. Now, if first of all, please press like and subscribe and share this audio with someone who you may think need it. If you're looking to go into opening up your own non-medical home health agency, please go to www.globaleliteacademy.net. That's www.globaleliteacademy.net. And we have two programs there. One program is the Do It Yourself. It's a course there that you take to open up your own non-medical home health agency. And you can also, if when you get the course, we will also give you a policy and procedure manual. So that's a really good deal. I think it's $2,500 for the course and your own, and then we'll give you your policy and procedure manual. Now, if you want to do one-on-one coaching with me, which means that we just take you from step one all the way over. We help you get your license if you need it. We help you get IHSS if you want it, which are patients who are low income. And you'll have a training class you'll go to twice a week for 4 hours. And we just help you step by step set up your own home care agency, non-medical. Now that is, if you want to get your license and IHSS patients, is $15,500. Now, the reason we charge just a little bit more than other agencies, through other consulting companies, is number one, we really help you get patients. And number two, we also, like I said, get you certified for IHSS. And most consulting companies do not do that. Now, this week, we're going to talk about Colorado, what is required to get your license in Colorado. Now, Denver, Colorado, you do have to have a license to open up a non-medical home health agency. You can have a referral agency and just get a certification. But for a non-medical home health agency, you need your license. It's called a Class B like boy license. Now, that license is approximately $2,000. And so when you upload your application, you would upload the payment as well. Now, they tell you it's going to take from 6 to 7 months. But I just got through helping a lady get hers in Colorado, and it only took 2.5 months for her to get licensed. She's licensed for a non-medical home health agency, and she also has her certification for IHSS. All of it took 2.5 months. So the state just gives you a rough period of time. They might say 5 months, 6 months, but it could take a little longer, but ours only took 2.5 months. Now, there's an agency up in Colorado Springs. Colorado Springs is smaller than Denver. And this agency, there's a non-medical agency, and they do IHSS patients as well. They make $25 million a year. That is some serious money. So when you do your license, you want to make sure that you get the IHSS certification. Now, IHSS is a community-based program, and it's paid for by Medicaid. And it's for people who are low income, but they need home health care, and they want to stay in the community. They don't want to go to, assisted livings or home care, or I'm sorry, assisted living or nursing homes. They want to stay in their home and have a caregiver in their home. And that's what IHSS is. Now, in some states, it's called different things. Like in Boston, it's called I think it's called Mass Health. So you could just Google, whatever state you're in, just Google, is there IHSS there, and what is it called? In Arizona, it's not called IHSS either, it's another name. But anyway, I'll tell you that when I get to those other states. So anyway, today we're doing Colorado. So you do need a license to have a Class B non-medical home health agency in Colorado. What else do you need? If you're going to have the IHSS patients, then you need to have an RN over that program. Well, I'm not going to say over the program. Let me rephrase that. You're going to have to be doing certain things yearly, like yearly evaluations. The first year evaluation, you don't need an RN. The second year evaluation, you do. So the RN would do the evaluation. And each patient is evaluated every year. Now, if you can hire you a RN, or there's a company in Colorado, in Denver, and that she's a nurse, and she sends nurses out to help non-medical agencies with this. She's the only one there that's doing it. It's a good business because there's no competition. So she'll send you, call her. I think it depends on what you want, so I'm not going to give you her fee because she has different things, and so it depends on what you're getting. But if you want the evaluation, the yearly evaluation, and then when the caregiver goes to a patient's house, they have to do a skill check. So the RN, she will send an RN out to go and do a skill check on that caregiver. And she would have to go do the skill check every time you put a new patient, every time you get a new patient and you put a caregiver in, or if you have an old patient but you're changing the caregiver, she would also have to go out to do a skill check. So this is just for IHSS patients. So that's what you would need your RN. And when you apply for the IHSS in Colorado, in Denver, they ask you, do you have a nurse? So if you're going to use this lady's company, you would put yes, you will have one, because the RN doesn't have to be on staff. So you're basically contracting her out. So therefore, you're not paying an hourly rate. There's a flat fee that they charge you monthly for this, and you just pay the flat fee. Or if you want to get your own nurse, you can always hire your own nurse. Hiring your own nurse may be a little bit tougher because they're going to want, even when they're not working, they're going to want an hourly rate probably. So even when you don't have anybody to send them out to, they're probably still going to do an hourly rate. But this lady, she wants just a flat rate. So you just pay her a small amount monthly. So it's a really good deal. I don't know if there's other people in other states that do this. But before, I'm going to talk about all of the states and the license and everything. So when I get to your state, I'll tell you if they have one in your area. But they do have one in Colorado area. If you have any questions, also you want to put them in the comments, and then I'll check them and answer your questions as we go on. All right. So you're going to get the IHSS program, and then you're going to get your regular license, Class B license. Now, we need patience. So what do we do for that? So, okay, let me back up a little bit. Sometime when people are starting out, they need help, virtual assistance or something, but maybe they can't afford to get it. So we help you. We help you to, if you go to my website, globaleliteacademy.net, we help you get employment from the Philippines, and you would pay anywhere from $3 and up an hour. And they could be your virtual assistants. They can help you hire people, whatever you want them to do. They're not in person, they're on the phone, so whatever you can find for them to do over the phone. They can even just, answer your phone, your business phone. So that's one thing that, we do offer and show you when you're trying to get your license. Trying to open up your non-medical home health agency. So the other thing is how to get your patients in Colorado. This is for the, Colorado. So there's something called referrals. And when you they're called paid referrals. And a lot of different companies have this. And you pay them to refer patients to you. Now, they're going to refer the patients to you and probably 3 more people, 3 more agencies. And so once they refer the patients, you have to be up on your skills to be able to close that deal. The patients cost anywhere from $25 a patient to $58 a patient. You probably could get some more than that. There's going to cost more than that because every company, have their own different rates. But this is a good rate, between 25 and 58 per patient. That's a really good rate. Now, some of them will charge you. There's one company that just charges you 1% of your invoice. They'll give you clients for 1% of your invoice of the patients that they give you. So it's called paid patient referrals. The other thing, especially if you go through my program, which is globaleliteacademy.net, we have a platform that you would go on to have access to any hospital in the United States. And, we're talking about Colorado, so let's keep it there. And we have 2 platforms. We have another one that will give you a lot of doctors' offices, PCP offices in the Denver and surrounding areas. Also rehab centers in the Denver and surrounding areas, and all of the hospitals in Denver. Now the platforms is separate. They have their own separate fee as to what they charge. One of the platforms, because when you come through my company, they'll give you, the regular price is $350 a month. But if you come through my company, they'll give it to you for $99 a month. The other company is very expensive because they have every single hospital. And they're going to charge you for a yearly. They charge, the total price is $7,500. And the $1,500 of that is to set you up, and then the rest goes towards the program. And you can also, pay monthly payments on that. But you could talk to them about that. Those are different platforms. I would advise you to get the platform that's $99, because the 7,000 platforms, that's just to get you in any of the hospitals, and that's going to be better for a skilled agency rather than a non-medical. And I will continue this next week talking about how to open a non-medical agency in the Colorado area. Thank you so much for tuning in. Have a great day.